Welcome back to my channel, Learn with Professor Janula. If you're new here, don't forget to subscribe and hit the bell icon for notifications. In today's video, we're going to learn about the physiology of third stage of labor. Let's get started. Hello students. Today we are going to learn about the third stage of labor. This stage begins immediately after the baby is born and continues until the placenta and membranes are completely expelled from the uterus. Even though the baby has already been delivered, the uterus keeps contracting during this stage, and these contractions help the placenta separate from the uterine wall and come out safely. Normally, this stage is short and uncomplicated. The average duration is about 5 to 15 minutes when the process is physiological. In a normal vaginal delivery, it should not last more than 30 minutes. If it gets delayed beyond this time, it can lead to complications such as excessive bleeding, so close monitoring and proper care are very important during the third stage of labor. Now let us understand the objectives of the third stage of labor. The first main objective is the separation of the placenta from the uterine wall. After the baby is born, the uterus contracts firmly, and these contractions help the placenta to detach safely from where it was attached inside the uterus. The next objective is the expulsion of the placenta, along with the membranes, through the birth canal. This should happen completely, because any retained placental tissue can cause complications. The final and very important objective is the prevention of postpartum hemorrhage. When the uterus contracts well after the placenta is expelled, it compresses the blood vessels at the placental site, which helps to reduce blood loss. So, proper management of the third stage of labor is essential to ensure the mother's safety and prevent excessive bleeding after delivery. Now we will discuss uterine contraction and retraction, which is an important process in the third stage of labor. After the baby is delivered, the uterus contracts very strongly. These contractions are necessary to help the uterus become firm and smaller. Along with contraction, another important process called retraction takes place. Retraction means that the uterine muscle fibers do not return to their original length after contraction, but instead they shorten permanently. Because of this, the size of the uterus gradually reduces. Due to contraction and retraction, the area where the placenta was attached to the uterine wall becomes smaller. This helps the placenta to separate easily from the uterus. At the same time, these strong uterine contractions compress the blood vessels at the placental site. This compression is very important because it reduces blood flow and prevents excessive bleeding. This action of the uterus is often described as a living ligature, meaning it naturally ties off the blood vessels. Overall, uterine contraction and retraction play a key role in placental separation and in preventing postpartum hemorrhage. Now let us talk about placental separation, which is the next important event in the third stage of labor. After the baby is born, the uterus becomes smaller because of strong contractions and retraction. As the uterus shrinks, the surface area of the uterine wall also decreases. Because of this reduction in surface area, the placenta, which cannot shrink like the uterus, starts to peel away from the uterine wall. At the same time, the uterine muscle fibers become thick and firm due to contraction and retraction. This change creates a shearing force between the placenta and the uterine wall. As a result of all these factors, the placenta separates naturally from its attachment site. This placental separation is essential for the placenta to be expelled completely and safely, and it also helps in reducing blood loss during the third stage of labor. Now, let us understand the mechanism of placental separation. After the baby is born, the uterus contracts and becomes smaller, but the placenta cannot contract like the uterine muscle. Because of this difference, stress develops at the area where the placenta is attached to the uterus. This leads to tearing at a specific layer called the decidua spongiosa, which is the normal plane of separation between the placenta and the uterine wall. As this separation begins, blood starts collecting behind the placenta. This collected blood further pushes the placenta away from the uterine wall and helps in completing the separation. So the inability of the placenta to contract, the tearing at the decidual layer, and the collection of blood behind the placenta together play an important role in the normal mechanism of placental separation during the third stage of labor. Now we will discuss one of the methods of placental separation called the Schultz method, also known as central separation. In this method, the separation of the placenta starts from the center while the edges remain attached for some time. As the placenta begins to separate, blood collects behind it and forms what is called a retroplacental clot. This collected blood helps to push the placenta further away from the uterine wall. Because separation starts from the center, the placenta usually comes out with the fetal surface first, which means the shiny side is seen first during delivery. In this method, most of the blood loss occurs after the placenta has been delivered, so there is less visible bleeding before expulsion. The Schultz method is the most common type of placental separation and is seen in about 80% of normal deliveries. Another method of placental separation and is called marginal separation. In this method, the separation of the placenta starts from the edges rather than from the center. As the edges separate first, blood easily escapes from the placental margin and flows out through the vagina even before the placenta is completely delivered. In the Duncan method, the placenta usually comes out with the maternal surface first, which means the rough, dull side is seen first. Because blood escapes early, this method is associated with more visible blood loss before placental delivery. Although placental separation is normal in this method, the increased visible bleeding makes careful observation very important during the third stage of labor. Now we will learn about the signs of placental separation, which help us know that the placenta has separated from the uterine wall. One of the first signs is that the uterus becomes firm, hard, and globular in shape due to strong contraction and retraction. This change can be felt on abdominal palpation. Another important sign is the lengthening of the umbilical cord, which happens because the separated placenta moves down into the lower uterine segment or vagina. Next, we will discuss the expulsion of the placenta, which is the final event of the third stage of labor. Once the placenta has completely separated from the uterine wall, it needs to be pushed out of the uterus. This expulsion mainly occurs due to strong uterine contractions, which continue even after the baby is born. These contractions help move the placenta downward. Along with uterine contractions, maternal bearing down efforts also help in expelling the placenta, especially when the mother is encouraged to push gently. Gravity also plays a role, particularly when the mother is in an upright or semi-sitting position. After separation, the placenta passes through the lower uterine segment, then through the cervix, and finally comes out through the vagina. Once the placenta and membranes are expelled completely, the third stage of labor is considered complete. Now let us understand how bleeding is controlled during the third stage of labor, a process known as hemostasis. After the placenta is expelled, the uterus contracts strongly and becomes firm. These uterine muscle contractions compress the blood vessels at the placental site, which helps to stop bleeding. This is one of the most important natural mechanisms for preventing excessive blood loss. In addition to contraction, thrombosis occurs in the torn blood sinuses where the placenta was attached. Small blood clots form in these vessels and further help in sealing them. Retraction of uterine muscle fibers also plays a major role, as the fibers remain shortened and keep the blood vessels compressed continuously. If any part of this process fails, the uterus may not contract properly, leading to postpartum hemorrhage. That is why careful monitoring and proper management during the third stage of labor are extremely important for the safety of the mother. Now let us look at the duration of the third stage of labor. Normally, when the third stage progresses in a physiological manner, it is quite short and usually lasts between 5 to 15 minutes. During this time, the placenta separates and is expelled naturally without any complications. If the third stage lasts more than 30 minutes, it is called a prolonged third stage of labor. A prolonged third stage is abnormal and increases the risk of complications, especially postpartum hemorrhage. That is why healthcare providers closely monitor the mother during this period and take timely action if the placenta is not delivered within the expected duration. Now let us understand the role of hormones in the third stage of labor. One of the most important hormones involved is oxytocin, which is released from the posterior pituitary gland after the baby is born. Oxytocin stimulates strong uterine contractions, and these contractions help the uterus become firm and smaller. This action supports placental separation and also helps in controlling bleeding. Oxytocin also enhances the process of placental separation by increasing the strength and frequency of uterine contractions. An important natural way to increase oxytocin release is breastfeeding immediately after birth. When the baby suckles, oxytocin levels rise, which further improves uterine contraction, helps in faster placental expulsion, and reduces the risk of postpartum hemorrhage. Now let us understand the importance of the third stage of labor in nursing and midwifery practice. This stage is very critical, and close monitoring by nurses and midwives plays a major role in preventing postpartum hemorrhage. By observing uterine contraction, blood loss, and signs of placental separation, complications can be detected early and managed promptly. Early identification of problems such as retained placenta is also very important. If the placenta or membranes are not expelled completely, it can lead to severe bleeding or infection. Active management of the third stage of labor, including timely interventions and proper care, helps in reducing maternal complications and mortality. Therefore, skilled nursing and midwifery care during this stage is essential for ensuring the safety and well-being of the mother. Hello, students. Let us now summarize what we have learned about the third stage of labor. The third stage begins immediately after the birth of the baby and ends with the complete expulsion of the placenta and membranes. Although it is a short stage, it is very important because many complications can occur if it is not managed properly. Uterine contraction and retraction are the key processes during this stage. They help in placental separation, expulsion of the placenta, and control of bleeding. Placental separation can occur by two methods, the Schultze method and the Duncan method, each having its own characteristics. Effective hemostasis after placental delivery is essential to prevent postpartum hemorrhage. Proper understanding and careful management of the third stage of labor by nurses and midwives play a vital role in ensuring maternal safety. This brings us to the end of today's class on the third stage of labor. I hope this session helped you understand the concepts clearly and in a simple way. Thank you all for listening patiently. If you have any doubts or questions, feel free to ask, and we can discuss them together. Keep revising the topic, and I'll see you in the next class. Thank you for watching.